8 reasons for missed period but not pregnant. Is your period late? Missed or delayed periods can result from various factors besides pregnancy. These causes span from lifestyle decisions to health conditions. Additionally, it's completely natural for women to experience irregular periods during 2 transitional stages of life, menarche, marking the onset of menstruation, and menopause. While the typical menstrual cycle lasts 28 days, variations between 21 and 35 days are considered normal. In this video, we'll explore potential explanations for why your menstrual cycle might extend beyond the usual duration. 1. Stress. Anxiety triggers your body's fight or flight response, leading to heightened production of stress hormones like cortisol. While some degree of stress is manageable, prolonged periods of stress can disrupt your body's hormonal equilibrium, potentially resulting in missed or irregular menstrual cycles. 2. Changed sleep schedule. When you abruptly alter your sleep patterns, it disrupts your circadian rhythm, which serves as your internal clock regulating bodily functions. As per a study featured in Frontiers in Endocrinology, disturbances to your circadian rhythm, particularly when traveling across time zones, can lead to irregularities in your menstrual cycle. 3. Being underweight. Low body weight often results in missed periods, with eating disorders like anorexia nervosa and bulimia frequently causing weight loss in women. When body weight drops to 10% below the norm, it can disrupt bodily functions and potentially halt ovulation. Gradually returning to a healthy weight can help restore normal bodily functions and regularize menstrual cycles once more. 4. Intense exercise. Although moderate exercise benefits the body, excessive physical activity can lower estrogen levels, a hormone crucial for regulating the menstrual cycle. Insufficient estrogen may lead to amenorrhea, characterized by the absence of menstruation. Athletes engaging in rigorous training frequently experience amenorrhea lasting 6 months or longer. 5. Polycystic ovarian syndrome, PCOS. PCOS is a condition characterized by elevated levels of the male hormone androgen and imbalances in other hormones, including insulin. This hormonal disruption leads to the development of cysts on the ovaries, which can result in irregular or absent ovulation. Treatment options such as birth control and medication can assist in regulating the menstrual cycle for individuals with PCOS. If you suspect you may have PCOS, it's advisable to seek guidance from your gynecologist. 6. Thyroid dysfunction. The thyroid gland plays a crucial role in producing hormones that control numerous bodily functions. Conditions like hypothyroidism and hyperthyroidism have the potential to disturb your menstrual cycle. Thankfully, thyroid disorders can be managed effectively with medications. If you suspect you may have a thyroid disorder, it's essential to consult an endocrinologist for a diagnostic blood test. 7. Medications. Some medications have the potential to disrupt menstrual cycles. For instance, antipsychotic medications can lead to an imbalance in prolactin hormone levels, resulting in amenorrhea or the absence of menstruation. Additionally, certain types of birth control, like IUDs, can also halt menstrual periods. 8. Early perimenopause. Menopause typically initiates between the ages of 45 to 55. When women experience menopausal symptoms at around 40 years old, it's termed early perimenopause. Early perimenopause occurs due to a decline in the number of eggs in the body, resulting in missed periods and eventual cessation of menstruation. This wraps up our compilation of potential causes for missed or delayed periods. Menstrual irregularities are relatively common, affecting up to 14% of women in the USA. However, prolonged absence of periods, except when using contraceptives, isn't considered normal. If you're consistently missing your period, it's advisable to seek medical advice from your physician. If you enjoyed watching this video, don't forget to like, subscribe and turn on the notification bell, so you don't miss any new videos. Let us know your thoughts about this video in the comments section down below, and feel free to stay and enjoy it until the end. Also make sure to check out our next highlighted video, and we will see you next time. Thanks for watching. Please like, share, and subscribe.